Good morning. I would like to thank the All India Ophthalmological Society and the Scientific Committee for this singular honor for an endowment lecture in the name of a person who really made me, made a lot of us, and made Indian ophthalmology. Having lived through both millennia and having spent nearly equal time in ophthalmology in the previous millennium and this one, I thought I was qualified to speak on changes in life and ophthalmology from the last millennium to this new millennium. Professor L.P. Agarwal was a true visionary. I would say he has done more for Indian ophthalmology than anyone else by bringing in the concept of subspecialties at a time when it did not exist, and all the subsequent fruit that we have seen is what has created this giant tree of Indian ophthalmology today. And there are too many things to speak about, but the father, truly the father, created the Rajendra Prasad Center, created the first ever national program related to ophthalmology globally. So we've had changes from the age of bullock cart to that of Chandrayaan and Mangalyaan in my lifetime. Being a small town boy from Barabanki to this journey to less black and white times, more colorful times, growing up, witness to the journey across 5 decades in my life in ophthalmology, inspired by the legends in ophthalmology, and you can see Professor L.P. Agarwal here. When I was the final year resident, the ORA secretary, and this was the occasion with the health minister, Harold Ridley here. So nostalgia is a dangerous illness, as this article in Times of India says, but then it has its own good points. Continual remembrance of a glorious past, individuals and nations find their noblest inspiration, as Sir William Osler said. Times have changed, and so has our lives. So have our lives. So I'm sure each one of these, including our brain, is now replaced by what we hold in our hands. And at the same time, ophthalmology has changed beyond recognition to what we do today as compared to when I started ophthalmology in 1978. You all will recall the younger ones amongst us. Dr. G.N. Rao will probably recall. This was the era of the Vespa scooters and the Ambassador car and those lovely radios and these phones without a dial. Earlier years in Barabanki was, cooling was done by those fans which were pulled by people. And these were the games we played, Colgate tooth powder, and the Prestige pressure cooker, and the letters and the telegrams that we sent. Our infotainment, our entertainment, our celebrations were simple. Life was much simpler. So we are products of the times of 50s and 60s. We documented in those simple ways rather than the more sophisticated ones that we do today. The eye care in those days, 4 days ago, the documentation was without any computers, laptops. So there were those slides which had to be put in boxes and, or even before that on transparent screens. It was a big struggle to document and getting slides made when we started making slides. And video editing was a real job. Communications for scientific purposes were tough. And the surgery has really transitioned. We lived through the era of intracapsular surgery without cryo to cryolets to cryo to sutures which were 6-0 to 8-0 to 10-0 to microscopic surgery to ECCs to ICCs to femtos, and so on and so forth. So those were the days when we did operate at times without gloves and in makeshift OTs with bulb lighting. All our earlier camps were like that. The sutures transitioned, microsurgery came. There were no microscopes in the beginning, and they were only imported microscopes. So you had Zeiss ones, which were difficult to import. Then the 40,000 Ascon microscope, then Apasami microscope. And we must give credit to these Indian manufacturers who made life so much easier for us, who made slit lamps which costed 10,000 at that time, and indirect ophthalmoscopes which costed 10, 15,000, the keratometer which cost 8,000, which made ophthalmology reach the smallest towns of India. So a lot of credit to. When you visit some of the other countries in the ASEAN region at that time, you realize how much difference this made to our Indian ophthalmology. Then came the era of the intraocular lenses, the pupil-supported ones. The posterior chamber came after the anterior chamber, and there were those designs. I remember using Shah and Shah lenses in one of the workshops, and we had some 6 hypopions, sterile reactions, but then IMD ones came, the J loops changed to C loops, and phacoemulsification, once the Rexis came in, became popular, and the foldable intraocular lenses made all the differences, and we now have a different era and a different system. So retinal detachment surgery, I remember those implants and explants that were made for surgery, and primitive cryo machines. The cryo machines from India came in somewhere around 78 with Appas introducing them. We did our orbital diagnosis with X-rays and venographies, where we injected in the veins on the externally to get an imaging to tell us where the tumors might be. No devices whatsoever when we started oculoplastics, and we did a lot of makeshift things, a lot of minor innovations, major innovations to fight those odds in oculoplastic surgery, creating implants from blocks or cutting them or using stillets for intubation and so on and so forth. A lot of things which were not being done, we had to introduce, fight with them, create an Oculoplastic Association of India, type those letters, call guests with emails. So it's been a wonderful, wonderful journey going through those times where things were evolving, where there was no equipment, where Indian ophthalmology was small, to an era where it has grown to be a world leader, and we are all proud of Indian ophthalmology. So human progress across eras takes place when, as Thomas Edison said, you try and find whatever better way of doing a thing is. And that's what we all have to keep striving. And let's not forget the objective of all progress, joy of taking the service to the last mile to carry the benefits to the underserved. Because as, again, quoting Osler again, practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. Thank you all. Thanks again for this oration and this honor.
Thank you so much, sir, for that wonderful endowment lecture.